A tempest of complaints was sweeping across the nation. From every corner, the same anguished voices could be heard echoing through the streets, in coffee shops, and in the corridors of power. The hospitals are deplorable, people whispered with desperation. The doctors are negligent, the nurses are rude, medicines are nowhere to be found. The litany of grievances seemed endless, each complaint more damning than the last. These cries of despair were reaching the ears of President Ibrahim Traoré, filtering through the marble walls of his palace like water through cracked stone. Day and night he found himself consumed by a single torturous question that gnawed at his consciousness. Why had his people's condition become so dire? Were his ministers telling him the truth about the state of healthcare, or were they painting a false picture, hiding the ugly reality beneath layers of bureaucratic deception? Late one evening, President Traoré sat alone in his ornate office, surrounded by towering stacks of files and reports. The golden chandelier cast long shadows across the mahogany desk as he pored over document after document, each one claiming improvements in the healthcare system. Yet outside these walls, the people's suffering continued unabated. The weight of responsibility pressed down upon his shoulders like a mountain of lead. A persistent question hammered in his mind with relentless intensity. Had their hospitals truly become hellish chambers of neglect for the sick and dying? He knew all too well that if he visited any medical facility in his official capacity as president, they would prepare elaborate facades, showing him only what they wanted him to see. The pristine wards, the smiling staff, the well-stocked pharmacies, all would be theatrical performances designed to mask the brutal truth. In that moment of crystalline clarity, a decision formed in his mind with the suddenness of lightning. He would abandon the trappings of power and walk among his people as one of them. No bodyguards would accompany him, no motorcades would announce his arrival, no protocols would shield him from reality. It would be just him and the unvarnished truth, however painful it might prove to be. Before dawn broke over the capital city, President Ibrahim Traoré rose from his bed with the quiet determination of a man embarking on a sacred mission. He moved through his private chambers like a ghost, selecting the most worn and humble clothing he could find. Old patched trousers replaced his tailored suits. A faded shirt bearing the stains of honest labor took the place of his pristine white formal wear. Battered shoes, their leather cracked and weathered, replaced his polished Oxford dress shoes. Standing before the mirror in his private dressing room, he barely recognized the figure staring back at him. Gone was the dignified bearing of presidential authority. In its place stood what appeared to be a common farmer, weathered by years of toil under the unforgiving sun. He pulled a worn cap low over his eyes, further obscuring his features. The transformation was complete and startling in its thoroughness. Slipping out of the palace through a side entrance used by the kitchen staff, President Traoré felt an odd mixture of liberation and anxiety coursing through his veins. The morning air was crisp and clean, carrying the sounds of a city awakening. Street vendors were setting up their stalls, laborers were boarding overcrowded buses, and the great machinery of daily life was grinding into motion. For the first time in years, he was anonymous, invisible, just another face in the crowd of struggling humanity. As he walked through the narrow streets, dodging potholes and navigating around vendors hawking their wares, he observed the pulse of his nation's real life. Children in tattered school uniforms hurried past, their faces bright with hope despite their circumstances. Mothers carried babies while balancing heavy loads on their heads. Old men sat on stoops, their eyes holding the wisdom and weariness of decades. None of them recognized him, and in their ignorance lay his opportunity to discover the truth. The largest government hospital in the capital city loomed before him like a fortress of despair. The building's exterior told a story of neglect that spoke louder than any official report. Paint peeled from the walls in long, leprous strips, revealing the raw concrete beneath. Windows were cracked or missing entirely, and the main entrance was surrounded by pools of stagnant water that had collected from a broken drainage system. Hundreds of people had gathered outside the hospital gates, creating a sea of human suffering that stretched as far as the eye could see. Some sat on pieces of cardboard or thin blankets. their belongings clutched tightly in their arms. Others leaned against the walls, too weak to remain upright without support. The air was thick with the sounds of coughing, crying, and quiet conversations filled with desperation and hope in equal measure. An elderly woman sat near the entrance, her breathing labored and irregular. Her son, a man in his 30s with calloused hands and worry lines etched deep in his face, fanned her continuously with a piece of torn newspaper. Nearby, a young mother clutched her feverish infant to her chest, rocking back and forth in a rhythm of maternal anguish. Children played in the dirt between the waiting crowds, their innocent laughter providing a stark contrast to the suffering that surrounded them. President Ibrahim Traoré took a deep breath and joined the queue. Just another desperate soul seeking medical attention. The line moved with glacial slowness, and he found himself witnessing scenes that would haunt him for the rest of his life. A middle-aged man collapsed suddenly, clutching his chest and gasping for air. The people around him called for help, their voices rising in panic, but the security guards merely shrugged and told them to wait their turn. After what felt like an eternity, he finally reached the registration desk. The nurse behind the counter was a study in bureaucratic indifference. Her eyes were fixed on her paperwork, and she spoke without looking up, her voice flat and mechanical. "Take a number and wait," she said, sliding a small piece of paper across the scarred surface of the desk. The number read 56, but the electronic display board showed only 12. The implication was clear. Hours of waiting lay ahead. The interior of the hospital was even more shocking than its exterior had suggested. The waiting area was a study in human misery, with every available space occupied by sick and suffering people. The air was thick with the mingled odors of disinfectant, sweat, and human waste. Ancient ceiling fans rotated slowly overhead, stirring the stifling air but providing little relief from the oppressive heat. Patients lay on thin mats spread across the floor, having given up hope of finding chairs. Some had been there for days, their relatives taking turns to hold their place in various queues. The walls were stained with mold and moisture, and in several places the plaster had crumbled away entirely, revealing the decaying infrastructure beneath. Ibrahim found a small space near a pillar and settled in to observe. What he witnessed over the following hours was a systematic breakdown of human dignity and medical ethics. A pregnant woman in obvious distress was told to wait because there were no beds available. When she began experiencing contractions, the staff remained unmoved, insisting that she follow the queue like everyone else. An elderly man, suffering from what appeared to be a heart attack, collapsed in front of the nurses' station. His family pleaded for immediate attention, but they were told that all doctors were busy. The man lay on the floor for nearly an hour before someone finally attended to him, and by then, his condition had deteriorated significantly. The most heartbreaking scene involved a young mother whose infant had been burning with fever for 3 days. She had traveled from a rural village, spending her family's life savings on transport to reach this hospital. When she finally managed to speak with a nurse, she was curtly informed that the pediatric ward was full and that she should try another hospital. The woman broke down in tears, explaining that she had no money left for further travel and nowhere else to go. Ibrahim watched all of this unfold with growing horror and rage. This wasn't just medical negligence. It was a complete abandonment of the fundamental principles of human care and compassion. The system he was responsible for had failed his people in the most basic and crucial way possible. When Ibrahim's number was finally called, nearly 6 hours had passed since his arrival. His body ached from sitting on the hard floor, and his throat was parched from the stifling air. He made his way to the doctor's office with mixed feelings of anticipation and dread. The doctor's room was a microcosm of the hospital's overall decay. The walls were covered with peeling paint and water stains from a leaking roof. Medical equipment sat gathering dust in corners, much of it clearly non-functional. Files were scattered across every surface, and the air was heavy with the smell of mold and neglect. Dr. Mahmoud, a man in his 40s with tired eyes and prematurely gray hair, sat behind his desk like a machine processing human suffering. He didn't look up when Ibrahim entered, continuing to scribble notes in a patient file. The interaction that followed would be burned into Ibrahim's memory forever. "What's your complaint?" the doctor asked without raising his eyes from his paperwork. "I've been having severe headaches and fever for several days," Ibrahim replied, adopting the humble tone of a common farmer. Without performing any examination, no checking of temperature, no looking into his eyes or throat, no taking of pulse or blood pressure, the doctor hastily scrawled something on a prescription pad. He tore off the sheet and slid it across the desk with the mechanical efficiency of an assembly line worker. "Take this to the pharmacy. Get these medicines." "Next patient." Ibrahim was stunned. "Doctor, shouldn't you examine me? Check my temperature at least?" The doctor finally looked up, irritation flashing in his eyes. "There are 50 people waiting outside. I don't have time for detailed examinations. The prescription will take care of your symptoms. But what if it's something serious? What if—" "Look," the doctor interrupted sharply. "I've been doing this for 15 years. I can diagnose common ailments without wasting time on unnecessary procedures. Take the prescription and go, or leave it and go. I don't care either way." The callous indifference in the man's voice was like a physical blow. Ibrahim realized that this wasn't just a problem of resources or training. It was a complete erosion of medical ethics and human empathy. He took the prescription and left the office, his mind reeling from what he had just experienced. The hospital pharmacy was located in the basement, reached by a narrow staircase that reeked of dampness and decay. The lighting was poor, provided by a few flickering fluorescent tubes that cast eerie shadows on the walls. A long queue of patients waited their turn, clutching their prescriptions like precious documents. When Ibrahim finally reached the counter after another hour of waiting, the pharmacist barely glanced at his prescription before delivering the crushing news. "Only one of these medicines is available. The rest are out of stock and have been for weeks." "When will they be restocked?" Ibrahim asked. The pharmacist shrugged with practiced indifference. "Who knows? Maybe next month, maybe never. Take what's available or leave it." Behind Ibrahim, a desperate mother with a sick child began to sob. Her child needed antibiotics that weren't available, and she had no money to buy them from a private pharmacy. The pharmacist watched her tears with cold detachment, offering no alternative solutions or even a word of comfort. Another patient, an elderly man with diabetes, was told that insulin hadn't been available for over a month. His family had been scraping together money to buy it privately, but the cost was bankrupting them. The man's son pleaded with the pharmacist to make an exception or find some emergency supply, but was met with bureaucratic stonewalling. Ibrahim witnessed several more heartbreaking scenes. A child with asthma whose inhaler was unavailable. A woman recovering from surgery who couldn't get the painkillers she desperately needed. A man with high blood pressure whose medication had been discontinued without explanation or alternative. Each case represented not just individual suffering, but a systemic failure. That was quite literally a matter of life and death for thousands of people across the nation. The magnitude of the crisis was becoming clear to Ibrahim, and with it, the full weight of his responsibility as the nation's leader. Determined to understand the full scope of the healthcare crisis, Ibrahim decided to visit a rural hospital. He knew that conditions in remote areas were often worse than in the capital, but he needed to see for himself how deep the problems ran. Early the next morning, disguised once again as a humble villager, he boarded an old, overcrowded bus heading to a small town 3 hours from the capital. The journey itself was an education in the struggles of ordinary citizens. The bus was packed beyond capacity, with people sitting in aisles and hanging from doors. The seats were hard wooden benches that hadn't been maintained in years. During the journey, he listened to conversations that painted a grim picture of rural health care. A farmer complained about having to travel for hours just to see a doctor, only to be told that the necessary medicines weren't available. A woman spoke of giving birth without any medical assistance because the local clinic had no staff. An elderly man described watching his wife die because they couldn't afford to take her to a private hospital in the city. The small-town hospital was a revelation, but not in the way Ibrahim had expected. Unlike the large urban hospital, this facility was actually clean and well-maintained. The building was smaller and simpler. but it radiated an aura of care and attention that had been completely absent from the capital's medical facilities. Upon entering, Ibrahim was greeted by a nurse who actually smiled and asked how she could help him. The waiting area, while modest, was clean and organized. Patients were sitting in actual chairs instead of on the floor, and the overall atmosphere was one of quiet efficiency rather than chaotic desperation. When his turn came to see the doctor, Ibrahim found himself face-to-face with Dr. Sarah Ahmed, a young woman in her 30s who had voluntarily chosen to work in this remote location. She took the time to actually examine him, checking his temperature, blood pressure, and pulse. She asked detailed questions about his symptoms and explained her diagnosis clearly and patiently. "I know resources are limited here," she told him, "but we try to make sure every patient receives proper care and attention. Sometimes that's more important than having the latest equipment." The contrast with the urban hospital was stark and illuminating. Here was proof that good health care wasn't just about money and resources. It was about commitment, training, and most importantly, retaining human compassion in the face of systematic challenges. Ibrahim's exploration of the healthcare system took a disturbing turn when he decided to visit a hospital during the night shift. He had heard rumors that conditions were even worse after dark, when administrative oversight was minimal and fewer senior staff were present. Arriving at a mid-sized hospital around midnight, he immediately noticed the difference. The security was lax, with guards sleeping at their posts. The lighting in many areas had been reduced to save electricity costs, creating pools of shadow that made navigation difficult and dangerous. The emergency ward was understaffed to a criminal degree. A single nurse was attempting to handle dozens of critical cases, running between patients like a person fighting a losing battle against time itself. Patients in obvious distress were left unattended for hours, their family members taking turns to provide basic care that should have been the hospital's responsibility. Ibrahim witnessed a traffic accident victim bleeding severely while waiting for a doctor, who was allegedly on call but nowhere to be found. A child having an asthma attack was treated by her grandmother with folk remedies because no medical staff was available to provide proper treatment. An elderly woman having a heart attack lay on a gurney in a hallway, surrounded by her weeping family, while the single nurse tried to juggle multiple emergencies simultaneously. The most shocking discovery was that several pieces of critical medical equipment had been shut down to save electricity costs. Ventilators, monitoring devices, and even some lighting systems were operating at reduced capacity or not at all. Patients who needed constant monitoring were essentially abandoned to fate during the dark hours. This night shift experience revealed another layer of the crisis. The healthcare system wasn't just failing during regular hours, but was virtually non-existent when people needed it most. Emergency medical care, the most critical component of any healthcare system, had been reduced to a mere pretense. Perhaps the most heartbreaking aspect of Ibrahim's investigation was his visit to various pediatric wards. Children, innocent and vulnerable, were suffering in ways that challenged his faith in human decency. The pediatric section of the main capital hospital was overcrowded beyond belief, with 2 or 3 children sharing beds meant for single occupants. The sight that would haunt Ibrahim's dreams was a ward where mothers slept on the floor beside their children's beds, having no other place to rest during their vigil. These women had been there for weeks, some for months, caring for children with conditions that could have been easily treated if proper resources and attention were available. A particular case broke Ibrahim's heart completely. A 7-year-old girl named Fatima had been brought in with acute malnutrition. Her condition was serious but entirely treatable with proper nutrition and medical care. However, the hospital's nutrition program had been suspended due to budget cuts, and her family couldn't afford the necessary supplements. Day by day, Ibrahim watched this bright, intelligent child growing weaker while her mother pleaded with doctors and nurses who had become immune to such pleas. Another child, a boy named Ahmed, had been waiting for a simple surgical procedure for over 3 months. The surgery would take less than an hour and cost very little, but the hospital's surgical schedule was so backlogged that non-emergency procedures were being postponed indefinitely. The boy's condition was deteriorating, and what had started as a minor issue was becoming a serious health threat. The pediatric pharmacy was particularly heartbreaking. Children's medicines were consistently out of stock, forcing families to choose between buying food and buying the medications their children needed to survive. Ibrahim saw parents selling their possessions, borrowing money at crushing interest rates, and making impossible choices between their children's immediate needs and their family's long-term survival. During his undercover visits, Ibrahim made it a point to speak with healthcare workers when opportunities arose. What he discovered was a system that was failing not just patients, but also the very people trying to provide care. Nurse Aisha, whom he met during a quiet moment in a rural clinic, painted a picture of professional frustration and personal anguish. "We became healthcare workers to help people," she told him, tears in her eyes. "But every day we watch people suffer and sometimes die because we don't have the resources to help them. It's destroying our souls." She described working 16-hour shifts because there weren't enough staff members to provide proper coverage. She talked about having to choose which patients to help first, when she should have been able to help them all. Most heartbreakingly, she spoke of watching preventable deaths because basic supplies or medications weren't available. Dr. Hassan, an older physician Ibrahim met in a hospital cafeteria, provided insight into the systemic issues causing the crisis. "The rot starts at the top," he said quietly, looking around to make sure he wasn't overheard. "Politicians make promises they never keep. Administrators steal money meant for medical supplies. We're given impossible caseloads and blamed when we can't provide miracles." He explained how medical professionals were leaving the country in droves, seeking opportunities abroad where they could actually practice medicine instead of just managing disasters. Those who remained were either the most dedicated or those who had no other options, and both groups were being slowly crushed by the weight of systemic failure. Ibrahim's investigation revealed that the healthcare crisis wasn't just about poor management or lack of compassion. It was fundamentally an economic disaster that was bankrupting families and destroying lives in ways that extended far beyond medical issues. He met families who had sold their homes to pay for medical treatment, parents who had taken their children out of school to work because medical expenses had consumed the family's education budget, farmers who had sold their land, their only source of livelihood, to pay for surgeries that should have been available through the public healthcare system. The economic impact was creating a vicious cycle. As people spent their life savings on medical care, they had less money for nutrition, education, and other necessities that would have prevented medical problems in the first place. Children who should have been learning to read were working in factories to pay for their siblings' medical treatments. Families were being destroyed not just by illness, but by the financial catastrophe that accompanied every medical emergency. Ibrahim realized that healthcare wasn't just a medical issue. It was an economic policy issue, a social justice issue, and ultimately a question of what kind of society his nation was choosing to be. The failure of the healthcare system was creating ripple effects throughout the entire social and economic structure of the country. After weeks of undercover visits to hospitals, clinics, and medical facilities across the nation, President Ibrahim Traoré returned to his palace with a heavy heart and a clear mission. His notebook was filled with detailed observations, heartbreaking stories, and concrete evidence of systemic failure that could no longer be ignored or explained away. The evidence was overwhelming and undeniable. The healthcare system wasn't just struggling, it was collapsing, taking with it the health, dignity, and economic stability of millions of citizens. The time for gradual reform had passed. What was needed now was nothing short of a complete transformation of the entire system. On a gray Monday morning, Ibrahim called an emergency meeting of his entire cabinet. The summons was urgent and non-negotiable. Ministers, health officials, and senior administrators were ordered to appear immediately. The tone of the message made it clear that this wasn't a routine briefing, but something far more serious. The presidential conference room filled with nervous officials who had no idea what was coming. Ibrahim entered the room carrying his notebook, the record of his undercover journey, and the weight of his discoveries was visible in every line of his face. "I have not called you here to listen to your excuses or your promises," he began, his voice carrying an authority that none of them had heard before. "I have called you here to confront you with the truth, a truth that you have either hidden from me or have been too incompetent to understand." "What?" Followed was perhaps the most intense governmental meeting in the nation's history. Ibrahim opened his notebook and began reading, page by page, the detailed record of his undercover journey. He described every scene he had witnessed, every patient he had seen suffer, every system failure he had documented. The room fell into stunned silence as he recounted the story of the 7-year-old girl dying of malnutrition in a hospital that lacked basic nutrition supplies. He described the pregnant woman who gave birth on a hospital floor because no beds were available. He told them about the man who died waiting for cardiac care while doctors were too busy to see him. "This is not a budget problem," Ibrahim said, his voice rising with controlled anger. "This is not a resource problem. This is a moral crisis. This is a complete failure of leadership at every level, and it ends today." Some ministers attempted to offer explanations or justifications, but Ibrahim cut them off. "I don't want to hear about budget constraints or staffing shortages. I want to hear about solutions. I want to hear about immediate action. I want to hear about how we're going to ensure that no citizen of this nation ever again has to choose between dignity and medical care." The Minister of Health, Dr. Rashid, tried to speak up. "Mr. President, surely you understand that comprehensive health care reform takes time. We can't transform the entire system overnight." "Doctor," Ibrahim interrupted, his voice like steel. "I have seen what happens when we move slowly. I have watched children die while we deliberate. The time for gradual change has passed. We are implementing emergency measures immediately, and anyone who cannot keep up with the pace of change will be replaced." Ibrahim outlined a comprehensive reform plan that was breathtaking in its scope and ambition. The plan addressed every aspect of the healthcare crisis he had witnessed, from infrastructure to personnel training to medical supply chains. First, immediate emergency measures. Every hospital in the nation would be audited within the next month. Medical supplies would be purchased and distributed on an emergency basis. Critical equipment would be repaired or replaced immediately, regardless of budget constraints. Second, personnel reform. All medical staff would undergo mandatory retraining, focusing not just on medical skills but on patient dignity and compassionate care. Performance standards would be established and enforced. Healthcare workers who consistently demonstrated excellence would be rewarded with salary increases and career advancement opportunities. Those who failed to meet standards would be retrained or removed from their positions. Third, infrastructure investment. Hospital buildings would be renovated or rebuilt as needed. Modern equipment would be installed in every facility. Information systems would be upgraded to ensure efficient patient flow and resource management. Fourth, supply chain management. A new system would ensure that essential medicines and medical supplies were always available. Regional distribution centers would be established to prevent shortages. Pharmaceutical partnerships would be negotiated to ensure affordable access to life-saving medications. Fifth, accessibility measures. Mobile medical units would be deployed to serve remote areas. Transportation assistance would be provided for patients who needed to travel for treatment. Economic assistance programs would ensure that no patient was denied care due to inability to pay. The scope of the plan was staggering, but Ibrahim made it clear that this was not optional. "This nation will have a healthcare system worthy of its people," he declared. "We will not rest until every citizen can receive medical care with dignity, respect, and effectiveness." The announcement of the Healthcare Reform Initiative sent shockwaves throughout the government and the nation. For the first time in years, ordinary citizens felt a glimmer of hope that their suffering might actually be acknowledged and addressed by their leaders. However, implementation proved to be more challenging than even Ibrahim had anticipated. Entrenched interests within the healthcare system resisted changes that threatened their comfortable positions. Pharmaceutical companies lobbied against supply chain reforms that would reduce their profit margins. Construction companies attempted to delay infrastructure projects to maximize their contracts. Some regional administrators tried to implement only cosmetic changes, hoping to satisfy oversight requirements without making substantive improvements. They painted walls, cleaned waiting areas, and instructed staff to smile more, while continuing the same negligent practices that had created the crisis. Ibrahim's response was swift and decisive. He established roving inspection teams with the authority to make unannounced visits to any medical facility in the country. These teams included not only medical professionals, but also patient advocates and even former patients who could recognize the difference between genuine reform and mere window dressing. When the first inspection reports came back, Ibrahim was both encouraged and frustrated. Some facilities had embraced the reform spirit and were showing remarkable improvements. Others had changed nothing substantial and were simply trying to game the system. The consequences for non-compliance were severe. Hospital administrators who failed to implement reforms were replaced. Doctors who continued to treat patients with indifference faced professional sanctions. Entire medical staffs at some facilities were retrained or transferred. 3 months after the reform initiative began, Ibrahim decided to conduct another series of undercover visits to assess the real impact of his policies. What he found was a healthcare system in the midst of a profound transformation. At the capital's main hospital, the first facility he had visited undercover, the changes were immediately apparent. The waiting area had been completely renovated with comfortable seating, adequate lighting, and even a children's play area. The registration process was efficient and courteous, with staff members who actually looked at patients when they spoke. More importantly, the attitude of the healthcare workers had undergone a dramatic shift. Ibrahim watched as a nurse took extra time to explain medication instructions to an elderly patient who had difficulty reading. He saw a doctor actually examine patients thoroughly, asking questions and showing genuine concern for their well-being. The pharmacy had been completely restocked and reorganized. Patients were receiving the medications they needed, and when certain drugs weren't available, alternatives were offered along with explanations and apologies. The difference was like night and day. In the pediatric ward, the transformation was even more remarkable. The overcrowding had been reduced through better patient flow management and the addition of temporary facilities. Most importantly, Ibrahim saw children receiving not just medical care, but also emotional support from staff members who had been trained to understand the psychological needs of young patients. However, the most moving changes were in the stories of individual patients. Ibrahim met the mother whose infant had been denied care during his first visit. Her child was now healthy and thriving after receiving proper treatment. The elderly man who had collapsed and been ignored was now receiving regular cardiac care that was keeping him stable and active. The healthcare reforms were creating positive effects that extended far beyond the medical system itself. Families were no longer being bankrupted by medical emergencies, which meant more money was available for education, nutrition, and economic development. Children who had been forced to work to pay for family medical expenses were returning to school. Small businesses were benefiting as well. When people weren't spending all their money on private health care, they had more to spend on goods and services. The economic multiplier effect of affordable health care was becoming apparent throughout the economy. Perhaps most importantly, the reforms were restoring people's faith in their government and their society. Citizens who had felt abandoned and forgotten were beginning to believe that their leaders actually cared about their welfare. This renewed trust was translating into greater civic participation and social cohesion. Ibrahim realized that healthcare reform hadn't just been about medical care, it had been about the fundamental relationship between a government and its people. By demonstrating that every citizen's health and dignity mattered, the reforms were helping to rebuild the social contract that holds societies together. 6 months after the healthcare reforms were implemented, international attention began to focus on the remarkable transformation taking place in Ibrahim's nation. The World Health Organization sent a delegation to study the rapid changes, documenting a healthcare system that had improved its performance metrics by over 300% in less than a year. Dr. Maria Santos, ECHO's regional director, was amazed by what she witnessed during her official visit. In 30 years of healthcare development work, I have never seen such comprehensive and rapid improvement, she told President Ibrahim during their meeting. What you've achieved here should be a model for developing nations worldwide. The international recognition brought both opportunities and challenges. Other countries began sending delegations to study the reform model, creating a new form of diplomatic soft power for the nation. Medical schools from around the world established exchange programs to learn about the integration of compassionate care with efficient systems. However, Ibrahim remained focused on the domestic impact. During a surprise visit to a rural clinic that had been established as part of the expansion program, he met Dr. Amina, a young physician who had returned from studying abroad specifically because of the healthcare reforms. "I had planned to build my career in Europe," she told him, not knowing his true identity as he sat disguised as a village elder. "But when I heard about the changes happening here, I knew I wanted to be part of building something meaningful in my own country. For the first time, I felt proud to be a doctor serving my own people." Stories like Dr. Amina's were becoming common across the nation. The brain drain that had plagued the healthcare sector for decades was reversing, as talented professionals saw opportunities to make a real difference at home. The healthcare reforms had also sparked a technological transformation that Ibrahim hadn't initially anticipated. The need to coordinate care across hundreds of facilities, manage supply chains efficiently, and track patient outcomes had driven rapid adoption of digital systems. A young engineer named Hassan had developed a mobile app that allowed patients to schedule appointments, check medicine availability, and even receive basic health advice. The app had been downloaded by over 2 million citizens in its first 6 months, dramatically reducing waiting times and improving patient satisfaction. Ibrahim learned about this innovation during one of his continued undercover visits to an urban clinic. He watched elderly patients using the app with help from their grandchildren, saw pregnant women checking appointment schedules from their homes, and observed how the digital system had eliminated the chaotic queues that had once characterized every medical facility. The technology wasn't just improving efficiency, it was empowering patients to take more active roles in their own health care. Digital health records meant that patients could receive care at any facility in the network without losing their medical history. Telemedicine services were connecting rural patients with specialists in major cities, eliminating the need for expensive and time-consuming travel. But the most impressive technological innovation was the National Medicine Tracking System. Every pharmaceutical product was now digitally tracked from manufacturer to patient, eliminating the chronic shortages that had once plagued the system. Real-time inventory management meant that supplies could be redistributed, from overstocked facilities to those experiencing shortages, within hours rather than weeks, perhaps. The most profound change Ibrahim observed during his follow-up visits was the cultural shift that had taken place within the healthcare system. The transformation wasn't just structural, it was fundamentally changing how healthcare workers saw their roles and how patients experienced care. During a visit to the pediatric ward where he had once witnessed heartbreaking scenes of neglect, Ibrahim found a completely different atmosphere. Nurses were reading stories to sick children. Doctors were taking time to explain procedures to worried parents. And the entire ward had been decorated with colorful murals created by local artists. Nurse Fatima, who had worked in the ward for over a decade, exemplified this cultural change. "Before the reforms, I felt like I was just processing patients like items on an assembly line," she explained to a group of nursing students. "Now I remember why I became a nurse, to heal not just bodies but spirits. When children smile because of something I've done, it reminds me that this work is sacred." The cultural transformation extended beyond individual attitudes to institutional practices. Every hospital had established patient advocacy programs where trained staff members helped patients navigate the system and ensured their voices were heard. Regular community feedback sessions allowed local residents to directly communicate with healthcare administrators about their needs and concerns. Most remarkably, the transformation had created a sense of professional pride that had been absent for years. Healthcare workers were no longer ashamed of their work conditions or embarrassed by the care they could provide. Instead, they had become ambassadors for the reformed system, taking personal responsibility for maintaining the improvements that had been achieved. The healthcare reforms had triggered an economic transformation that extended far beyond the medical sector. Ibrahim's economic advisors presented him with data showing that the improved healthcare system had become one of the nation's most significant economic drivers. Medical tourism, previously unthinkable given the system's poor reputation, was beginning to emerge. Patients from neighboring countries were choosing to receive treatment in facilities that now offered high-quality care at affordable prices. This influx of medical tourists was generating foreign currency and creating jobs throughout the economy. The pharmaceutical industry had also been revitalized. New manufacturing facilities were being established to meet the increased demand for medicines, creating thousands of jobs for skilled workers. Quality control standards had been raised to international levels, opening opportunities for pharmaceutical exports. Perhaps most importantly, the reduction in healthcare-related bankruptcies was freeing up household income for other expenditures. Families that had once spent their entire savings on medical emergencies now had money available for education, housing improvements, and small business investments. A microfinance study revealed that loan default rates had dropped by 40% since the healthcare reforms were implemented. The primary reason was that families were no longer being hit with unexpected medical expenses that destroyed their ability to repay other debts. Small businesses were thriving as well. When people weren't living in fear of medical bankruptcy, they were more willing to take entrepreneurial risks. The number of new business registrations had increased by 25% in the year following the healthcare reforms. Ibrahim discovered an unexpected connection between healthcare reform and educational outcomes during one of his visits to a rural school. The principal, Mrs. Khadija, explained how improved access to healthcare had transformed her students' academic performance. Before the healthcare reforms, we had children missing school for weeks because they or their family members were sick, she said. Parents were taking children out of school to work and pay for medical expenses. Now our attendance rates have improved dramatically, and parents are investing in their children's education instead of spending everything on health care. The school had implemented a partnership with the local clinic to provide basic health screenings for students, catching problems early before they became serious. A simple program providing eyeglasses to children with vision problems had improved reading scores across the district. Ibrahim realized that healthcare reform wasn't just about treating illness. It was about creating the foundation for human development in all its forms. Healthy children learned better, healthy parents worked more productively, and healthy communities were more stable and prosperous. The connection between health and education was particularly evident in rural areas, where improved access to health care had convinced many families to keep their children in school rather than sending them to work in the cities. High school graduation rates in rural areas had increased by 30% in the 2 years following the healthcare reforms. One of the most significant, but initially overlooked aspects of the healthcare transformation was the attention given to mental health services. Ibrahim had not initially focused on this area during his undercover visits, but feedback from reformed facilities revealed a massive unmet need for psychological and psychiatric care. Dr. Ahmed Mansour, a psychiatrist who had returned from training abroad to join the reformed system, explained the scope of the challenge. We discovered that many of the physical complaints patients were bringing to our clinics were actually manifestations of untreated depression, anxiety, and trauma, he told Ibrahim during a briefing. The previous system had completely ignored mental health, creating a crisis that was hidden beneath the more visible problems. The integration of mental health services into the general healthcare system produced remarkable results. Patients who had been frequent visitors to emergency rooms with vague physical complaints were diagnosed with treatable mental health conditions. Support groups for chronic disease patients improved both psychological well-being and physical health outcomes. A particularly successful program paired mental health professionals with traditional healers, creating a culturally appropriate approach to psychological care that respected local traditions while incorporating modern therapeutic techniques. This program had been especially effective in rural areas, where mental health services had previously been completely unavailable. The mental health initiatives had also addressed a significant social problem: domestic violence. Healthcare workers had been trained to recognize signs of abuse and provide appropriate referrals to support services. Safe spaces had been created in hospitals and clinics where victims could receive both medical and psychological care. As the healthcare system stabilized and improved, Ibrahim began to focus on the environmental factors that were contributing to health problems in the first place. His undercover visits had revealed that many of the illnesses he witnessed were preventable conditions caused by poor sanitation, contaminated water, and air pollution. The healthcare reforms evolved to include a comprehensive environmental health program. Community health workers were trained to identify and address environmental hazards in neighborhoods and homes. Water quality testing became routine, and contaminated sources were quickly remediated. A particularly innovative program involved training healthcare workers to conduct environmental health assessments as part of routine patient care. When doctors saw patterns of respiratory illness in certain neighborhoods, environmental teams would investigate potential air quality problems. Clusters of gastrointestinal illness led to water quality investigations and sanitation improvements. The program had identified and remediated hundreds of environmental health hazards that had been sickening communities for years. Simple interventions like improving waste management, fixing water supply systems, and reducing industrial pollution were preventing thousands of cases of preventable illness. Ibrahim was particularly proud of a program that had transformed urban slums from disease-breeding environments into healthy communities. Working with local residents, health teams had improved sanitation, established clean water access, and created green spaces that improved both physical and mental health. The transformed healthcare system had also become a catalyst for medical research and innovation. The comprehensive patient data systems, improved facilities, and motivated staff had created an environment where meaningful research could flourish. Dr. Sarah Hassan, a researcher at the National Medical University, had established a program studying traditional medicines using modern scientific methods. Her work was identifying compounds in local plants that could be developed into new pharmaceuticals, potentially creating a new industry for the nation. The standardized data collection across all healthcare facilities was creating unprecedented opportunities for epidemiological research. Patterns of disease prevalence, treatment effectiveness, and public health trends were being analyzed to guide future policy decisions and medical interventions. International pharmaceutical companies were beginning to establish research partnerships with local institutions, attracted by the high-quality data and well-managed patient populations available for clinical trials. These partnerships were bringing both investment and knowledge transfer to the nation's healthcare sector. Perhaps most importantly, the research programs were training a new generation of healthcare professionals who understood both clinical care and scientific investigation. These individuals were becoming leaders not just in their own country, but throughout the region. 2 years after beginning his undercover investigation, President Ibrahim Traoré reflected on the extraordinary journey he and his nation had taken. The healthcare system had been transformed beyond recognition, but he knew that the work was far from over. Maintaining the reforms would require constant vigilance and continuous improvement. New challenges would emerge and the system would need to adapt and evolve. Most importantly, the culture of compassion and excellence that had been established would need to be preserved and strengthened over time. Ibrahim had learned that leadership wasn't just about making policy decisions from the comfort of an office. It required understanding the real experiences of the people being served. His undercover journey had taught him more about governing effectively than all his years of formal education and political experience. The notebook from his undercover visits remained on his desk, now supplemented by regular reports from ongoing monitoring visits. He had institutionalized the practice of unannounced leadership visits, making it clear that authentic accountability would be a permanent feature of his administration. During his most recent undercover visit to a remote rural clinic, Ibrahim had encountered a young boy who was receiving treatment for a condition that would have been fatal under the old system. The boy's mother, unaware she was speaking to the president, had said simply, "Finally, we feel like human beings when we come here for help." Those words captured the essence of what the reforms had accomplished. They had restored not just health services, but human dignity to the process of seeking care. They had demonstrated that government could be a force for genuine improvement in people's lives, and that the trust between citizens and their leaders could be rebuilt through authentic commitment to the common good. The success of Ibrahim's healthcare Reforms had attracted attention from leaders across the region and beyond. A coalition of developing nations had formed to study and adapt the transformation model to their own contexts. Ibrahim found himself in the unexpected role of mentor to other presidents and prime ministers who were grappling with similar healthcare crises. During a regional summit, President Maria Gonzalez of a neighboring country approached Ibrahim with a personal request. "My people are suffering just as yours were," she confided. "But I don't know where to begin. The problems seem so overwhelming, and every expert gives me different advice." Ibrahim's response was simple but profound. "Start by seeing the problem through your people's eyes. Spend a day as one of them in your hospitals. Everything else will become clear after that." 6 months later, President Gonzalez implemented her own undercover hospital visit program, leading to reforms that were adapted to her nation's specific cultural and economic context. The success of her initiatives validated Ibrahim's belief that authentic leadership could be replicated and scaled. A network of health reform leaders began meeting regularly to share experiences, challenges, and innovations. This informal group was having a measurable impact on healthcare quality across multiple nations, demonstrating how one leader's courage to confront uncomfortable truths could inspire regional transformation. Perhaps the most promising aspect of the healthcare transformation was its impact on young people entering the medical profession. Medical schools throughout the nation had redesigned their curricula to emphasize not just clinical skills, but also empathy, cultural competence, and systems thinking. Dr. Aisha Malik, dean of the National Medical School, had instituted a requirement that all medical students spend time working in the reformed healthcare system before graduation. "We want our graduates to understand that medicine is not just about diagnosing and treating disease," she explained. "It's about serving human beings with dignity and compassion." The program had produced remarkable results. New medical graduates were more likely to choose careers in primary care and rural medicine. They demonstrated better communication, skills with patients, and showed greater commitment to serving underserved populations. Ibrahim had the opportunity to address a graduating class of medical students during one of his public appearances. "You are inheriting a healthcare system that was built on the principle that every human being deserves dignity and care," he told them. "Your responsibility is not just to maintain what we have built, but to continue improving it for future generations." The response from the students was overwhelming. Many approached him afterward to express their commitment to upholding the values that had guided the reforms. Several announced their intentions to work in rural areas or with marginalized populations, seeing these assignments not as sacrifices, but as opportunities to make meaningful contributions. As the reforms entered their 3rd year, Ibrahim and his team faced the critical challenge of ensuring long-term sustainability. The initial transformation had been driven by crisis and presidential urgency, but maintaining progress would require institutional mechanisms that could outlast any individual leader. The solution came from an unexpected source: the communities themselves. Patient advisory councils had been established at every healthcare facility, giving local residents formal roles in monitoring quality and advocating for improvements. These councils were becoming powerful advocates for maintaining high standards. In one rural district, a patient advisory council had identified a decline in service quality at their local clinic. Working with regional health administrators, they had implemented corrective measures before the problems became serious. The incident demonstrated that the reformed system had created stakeholders at every level who were committed to preserving the gains that had been achieved. Ibrahim also established the National Health Service Corps, a program that provided scholarships to medical students in exchange for commitments to serve in underserved areas. This program was ensuring that rural and poor communities would continue to have access to qualified healthcare providers. Perhaps most importantly, the healthcare reforms had been codified into law, making it difficult for future administrations to reverse the progress that had been made. Constitutional amendments guaranteed citizens' rights to healthcare, creating legal frameworks that would survive political transitions. The undercover hospital visits had changed Ibrahim not just as a leader, but as a human being. The experience of witnessing suffering firsthand and then seeing the power of systematic change had deepened his understanding of both governance and human nature. During a quiet moment in his office, Ibrahim reflected on how the journey had affected him personally. The president who had begun this journey was well-intentioned but somewhat disconnected from the daily realities of his citizens' lives. The leader who emerged from the experience was fundamentally different, more empathetic, more practical, and more committed to authentic service. His family had noticed the change as well. His daughter, a university student studying international development, told him during a family dinner, "You're different now, Papa. You talk about people differently. It's like you really see them now, not just their problems." The transformation had also affected Ibrahim's approach to other policy areas. He had begun conducting similar undercover visits to schools, courts, and other public services. Each investigation revealed opportunities for improvement and strengthened his commitment to leadership, based on genuine understanding rather than bureaucratic reports. The story of Ibrahim's healthcare transformation had captured international attention in ways that transcended typical diplomatic relations. Medical schools around the world were teaching case studies based on the reforms. International development organizations were incorporating the ground-up leadership approach into their training programs. Documentary film about Ibrahim's undercover visits had been translated into dozens of languages and was being used to train public officials in countries across multiple continents. The film's message, that effective leadership requires leaders to understand their citizens' experiences firsthand, was resonating with audiences far beyond the healthcare sector. The United Nations had invited Ibrahim to address the General Assembly on the topic of healthcare reform and democratic leadership. His speech focused on the principle that leaders must serve among the people they lead, received standing ovations and sparked discussions about new approaches to governance and public service. International NGOs were adapting the undercover visit methodology to other sectors. Education reformers were spending time as substitute teachers in struggling schools. Housing officials were living temporarily in public housing projects. The ripple effects of Ibrahim's initial decision to disguise himself as a patient were spreading throughout the international development community. 5 years after, President Ibrahim Traoré first donned the clothes of a common farmer and walked into that devastating hospital waiting room. The healthcare system he had found in crisis had become a model for the world. But more importantly, the principles he had discovered during that journey had become the foundation for a new kind of leadership. The story had become legend, but the work continued. Every month, Ibrahim still conducted undercover visits to various public facilities. His commitment to understanding his citizens' experiences firsthand had become a defining characteristic of his presidency and an expectation for future leaders. The notebook from his original hospital visits remained on his desk, now accompanied by dozens of others documenting his ongoing explorations of public services. Each notebook told stories of problems identified, solutions implemented, and human dignity restored through committed leadership. During his most recent visit to the hospital where his journey had begun, Ibrahim found a completely transformed institution. The waiting room that had once been a chamber of despair was now a place where patients received care with dignity and respect. The staff who had once treated patients as burdens now saw them as human beings, deserving of compassion and excellent care. A young mother with her infant daughter was leaving the pediatric clinic as Ibrahim, disguised once again as an elderly villager, was arriving. She was smiling as she spoke to her child. "The doctor says you're going to be just fine, my darling. These people really care about us." Those words, "these people really care about us," captured the essence of what the transformation had accomplished. It had restored not just healthcare services, but the fundamental relationship of trust and care between a government and its people. The legacy of President Ibrahim Traoré's undercover hospital visits would endure not just in the healthcare system he had reformed, but in the principle he had established, that authentic leadership requires leaders to see the world through their citizens' eyes, to share their struggles, and to work tirelessly to ensure that every person is treated with the dignity and care they deserve. The journey that had begun with one leader's courage to confront an uncomfortable truth had become a permanent part of how leadership was understood and practiced. It had demonstrated that when leaders truly understand their people's experiences, they can create transformations that seemed impossible, and that the most powerful force for change is authentic human connection and compassion. In government buildings around the world, a simple question had become a standard part of leadership training. When did you last experience your policies from your citizens' perspective? The answer to that question, inspired by Ibrahim's example, was determining whether leaders would govern with genuine understanding or remain trapped in the comfortable but dangerous isolation of power. The story continued, not as a completed achievement, but as an ongoing commitment to the principle that effective leadership is not about commanding from above, but about serving, alongside those who have entrusted leaders with the responsibility of governance. Ibrahim's notebooks continued to fill with observations, and his nation continued to benefit from a leader who never forgot what he had learned during those transformative days when he walked among his people as one of them.